Okay. Hi there. How are you doing?
I'm good, thank you.
I always feel weird doing that because we had this really cool conversation before, and I never know if I should pretend we weren't having it. I don't know what the etiquette is. We've been dancing around each other on social media for a while, and I really admire your work. And you did a post about how much school you had done, and I think it's up to 17 years. You're a urogynecologist, female pelvic medicine specialist at Cedars-Sinai. Uh, Co-founder
Yes.
in a line of all natural lubricants for women called Glissant. Glissant, am I saying that correctly?
Yeah.
Member of a trio
Yes.
of doctors called the Down There Doctors. Love it. And you three have written a book called A Woman's Guide to Her Pelvic Floor. What the F is going on down there?
Yes.
You also say this is 50-ish, which I love, and I think I'm probably going to borrow. Um, but 17 years in school, and then those three doctors, you've been in school for like, decades and decades. So you know exactly what you're talking about. And I have, like I just told you before, I thought, what am I going to ask Dr. Karyn? And then I basically was almost late for our interview while I was furious. So I
Ask away.
I want to start out with just a really broad, nice top line. Um, what is going on with our vaginas and pelvic floors in perimenopause and menopause?
Well, I think it's what happens probably to the rest of our bodies in perimenopause and menopause, right? We don't really at least I didn't pay so much attention until you start getting older and things don't bounce back and act the way that we're used to, right? So we just get to that age where 40, mid 40s, 50s, nothing really lasts that long, whether it's your car, your house, your body, and then throw in some hormonal changes, which I always find interesting that we don't attribute things to hormonal changes like we should, which are changes in our vagina or the way we urinate or just the way we feel, versus we attribute a lot of things that we shouldn't cause or that we shouldn't blame hormones for, like no, I'm not hormonal. I just don't really like you and I'm not very happy with you at the moment. So many things go on down there and I'm also fascinated that and this is one of the reasons why we wrote the book. We don't really give women much education about what to expect down there. First of all, right after you have a baby, I see so many women who are so embarrassed and so ashamed and honestly just break down in tears when you tell them, this happens all the time after delivery. And our society, we romanticize pregnancy and delivery, which is fine, but then you got to tell the woman it's not all butterflies and unicorns after you have the baby down there. It was very interesting. Years ago, we did a study interviewing women in their first trimester of their first pregnancy and saying, what is your birth plan? And of course, most people want the natural delivery, which not wanting drugs when you're going to be in pain is a whole other question we can discuss. But of course, everyone wanted vaginal delivery. And we told them all the risks of having a vaginal delivery versus having elective cesarean. And of course, every woman still wanted to have a natural birth. But the difference was at least they felt better that they knew what to expect afterwards. And I think that this is a big mistake that we are not educating young women. We should just offer a class in college, like what happens to your body later? Or all of these prenatal books, yes, it's important to talk about breastfeeding, everything else, but we don't talk about anything pelvic flourish until afterwards when you're, wetting yourself and having other issues down there.
So a lot of it's stemming from child having children, right? A lot of it's sort of
Absolutely.
what's happening and so a lot of it's wear and tear, and a lot of it because I haven't had children and I'm having some wear and tear as well. So it's not just, and I did have this sort of fallacy, and I'd heard it was out there, but I was like, I'll be fine because I haven't had kids. My vagina isn't going to be perfect. But and I'm not going to have any incontinence or anything like that. But it's wear and tear, and it's having the problems in childbirth and maybe not. What are your top recommendations for some of the issues that can crop up that we haven't been dealt with before?
Well, theoretically, every woman should probably start exercising her pelvic floor before she has babies or before she gets older. Right? I mean, you can have the perfect body exercise, none at all, right? In your 20s and 30s, and you're looking super hot. And then all of a sudden you look down your 40, you're like, what happened down there? It's the same with our pelvic floor. It's muscles. If you don't use them, they're going to go away. Um, However you want to take this, you could also use a vibrator on a more regular basis. Another research project we did was having women use a vibrator on a regular basis. And I'm going to give a shout out now to V for Vibes, who actually donated 100 vibrators for our study. Because when we remove a man's prostate for cancer, we put him on Viagra or a similar medication right afterwards, because that increased blood flow helps things to heal. We don't really have the equivalent for women. Women typically can't tolerate those medications because you'll get a bad headache. But if you use a vibrator on a regular basis, so a couple times a week, whether you orgasm or not, you are increasing that pelvic blood flow, helping your tissues. And in fact, if you also have orgasm, when you orgasm, you're having that rhythmic contraction of your pelvic floor, which is kind of the ultimate Kegel, if you will. And so in our preliminary study, whether it was incontinence, pelvic pain, prolapse, every woman felt like they improved some, and especially their overall feeling of well-being. So, whether it is your Kegel exercises, being sexually active on a regular basis, using a vibrator on a regular basis, all those things can help. And then if a woman becomes perimenopausal and menopausal and has symptoms down there, if she's not going to take systemic hormones, it is perfectly safe to do local hormones. Even women who have breast cancer can do that.
Okay. And just when you say use a vibrator, people always say use a vibrator, but I'm like, do you mean use a vibrator inserting it inside yourself, or just, what do you
Probably doesn't matter. In
Okay.
our study, because we had a wide range of ages, and also for some women who'd never used them before, it can be a little intimidating. So they all did it externally. But I don't really think it matters, because as long as you're increasing arousal and getting that blood flow down there, doesn't really matter. And that's another whole other discussion we could probably have. How do you choose a vibrator? There is no like kind of guide for that. And some look really scary for people.
Yeah. Okay. Do you have a top line recommendation for something people should use?
I think if people start, I think a very simple, just, bullet shaped vibrator, and then probably start externally. But it's like anything, whether you're masturbating with just your own hand or with a vibrator, you've got to just experiment. And I also think that women who are maybe not comfortable with a partner, I think that's also a great way for her to get to know herself. Or let's say you've kind of hit this wall in your relationship, and sex isn't so good. It's another way also to figure out, hey, what do I like, so I can tell my partner. And it's really cute. My husband will probably kill me if he ever hears this podcast. But of course, like I had all these vibrators on my desk, because we're looking at them for our study. And he's like, "What are those?" And I said, "Well, they're vibrators." Like, "Well, you don't need that." It's so cute, because I'm like, "Oh, honey."
You
But
don't
I
need
think it's
that.
so right. But we accept that men masturbate all the time, right? Like the joke is 99% of men masturbate, the other 1% lie about it.
Yeah.
But as women, we're not supposed to. I think that's such a double standard. And don't even get me started about the discrepancy between men and women's health.
Yeah. Okay. Gen X really has a problem with that. Like our age group has a problem with this. I don't, shouldn't have to, I'm not supposed to, we came late to all of this. And
Yeah.
I know I interviewed someone from a vibrator company that doesn't really look like a vibrator. And she said they sold really well because people were just more willing to buy them than to buy another kind of vibrator. And so basically I got in trouble once for saying, use it or lose it because it's ableist, but dancing around, we do need to use it. I saw you
Yeah.
post that on social media. That's one thing you
Yeah.
would never not do, right? Is not use it.
Right.
Okay.
Well, and you can put the disclaimer, use it or lose it to the extent that you can. And if you can't, and it's a problem for you, then you probably should seek help. So this is also the difference between what is just not being sexually active versus having sexual dysfunction. It's really whether it causes you distress or not. So there are many people who could care less, and whether that's because it's hormonal, they've had bad relationships, whatever the cause, and that's not distressing. But on the other hand, a woman who's trying to be sexually active and she can't because it's painful or other reasons, and it's really causing her distress personally in her relationship, that's when she should seek help for that.
Okay. I think one of the problems, or do you see this, is that sometimes relationships, you mentioned relationship breakdown. So the sexual part of the relationship has broken down. It's not being addressed. It's just sort of like avoiding it. And it's happening at a time when these other problems are happening. Do you see that intersection?
All the time. All the time. In younger, and not to be biased, but it's a fact. In younger couples, it's probably more of an issue, right? Just because the partner is also younger, and everyone has like a higher libido when you're younger. And I think more of those women probably seek help just because it is a matter of like breaking up and they've got young kids or whatever it is. When a couple is older, what I think is a shame is the path of least resistance is to do nothing. And they're like, well, we had a good sex life before. And if you're okay with that, that's fine. It's just, it's a shame if you let it go simply because you don't know that there are things that can be done. And it's often not just one partner. So as a urologist, I take care of men and women, and you'll see that, the woman avoids sex because of pain. The man avoids sex because he's got a little erectile dysfunction. Both problems are not that difficult to fix, but because there's two small problems, it's easier for them just to cuddle and go to sleep and let that part of the relationship fall by the wayside.
Right. Right. Very interesting. Okay. So I have always wanted to know, what is the definitive guide to work? I need to read your book. What is the definitive guide to working my pelvic floor in a way that makes it strong, but not too strong? Do I need an inserted thing with an app? Can I do Kegels without anything? Do I need to be grabbing onto something? Where are we at right now with the latest sort of guidance?
I mean, yes, yes, and yes. There is no Bible. There is no actual scientific routine per se. But I think that pelvic floor physical therapy has really made leaps and bounds. So when I started out practice 20 years ago, you were hard pressed to find one. Now they're all over, social media. And really what's important, and again, I always find that it's fascinating. We really separate our pelvic floor from the rest of our body, but the physiology applies everywhere. So let's say that for you, doing, curls with little weights is the best thing for your arms. Otherwise, your arms get too big and you don't like that they don't look toned. So then you've got a certain workout for yourself per se. So some women, they can do their Kegel exercises simply by pretending they're trying to stop themselves from passing gas. And they really get it. They can feel that pelvic floor pull up and they're perfectly fine. Other women have a really hard time isolating their pelvic floor. They need not just some device to go in the vagina so that they can feel the stimulation, but they also need a physical therapist to kind of coach them through it. And there are biofeedback machines that we can tell if you're isolating your pelvic floor, how strong your contraction is. So it is varied, but if you're not sure, that's why I think it's really great to check in with a pelvic floor physical therapist.
And that's like, they will guide you through this. You don't have to be
Absolutely.
on the wilderness
Absolutely.
and this out. Okay.
And they may not like the way that I phrase it, but I tell my patients, it's like a personal trainer. So some people just need their exercise routine set up and they're motivated and they get it and they'll just check in periodically with a personal trainer. Other people need their personal trainer multiple times a week or they'll never do their exercises.
Yeah, that's true. Okay. So tell me about the intersection of vaginal hormone therapy, urinary tract health, vulva health, vaginal wall thinness health. Am I making sense?
Yes. Yes. Well, the intersection is all the way back to when we're born. So the whole genitourinary tract, there are estrogen receptors in the bladder, in the urethra, of course, in the vagina. That's why when women get perimenopause or menopausal, everything kind of goes to, SHIT down there for a lot of women who are extremely sensitive to hormones. And that's also why a lot of women will have relief of what is now referred to as genitourinary syndrome of menopause, which we used to lovingly refer to as atrophic vaginitis. That always makes you feel good when your vagina is wasting away. And that's why estrogen in the vagina will actually get rid of a lot of these problems for women. And what is interesting and what is difficult for a lot of women to comprehend is even if you're taking systemic estrogen, you don't always concentrate enough vaginally to get rid of your urinary and vaginal problems. So there are a fair number of women who take systemic estrogen and still need vaginal estrogen to help those symptoms down there. And even if you add a vaginal estrogen, you do not need to adjust your systemic dose because what you use locally does not really affect your systemic estrogen levels in any significant amount.
What is your favorite way to prescribe, or is it different for every woman? Can you kind of frame that?
Well, I mean, I'm a little jaded because I'm mostly seeing women, obviously, for the urinary issues. A lot of them are already on systemic estrogen, so we'll just give local estrogen. Unfortunately, so many women have been scared by bad data that even if you want to give them systemic hormones, they only want to do vaginally. And it's also interesting, even with all the published data, um, there are even some doctors who will tell their patients that vaginal estrogen is not safe. But it is. It really, the problem is the packaging on the vaginal estrogen still has to list all of the risks of systemic estrogen, which really isn't actually true. So for me, my favorite, if you will, oftentimes is vaginal estrogen cream to start, because for a lot of women, it just feels soothing. You can adjust the dose easier than with the suppositories. I like the vaginal estrogen ring because it is a little bit higher dose, but the insurance coverage, I know you're in Canada, the insurance here is different. And so for a lot of women, it's not covered by insurance. And even if I had a favorite, honestly, what a woman ends up with often is determine what's covered and it was not covered by her insurance.
Testosterone, that's not covered by insurance, but I have talked to some people who say there is a role for testosterone, whether applied directly or whether you're taking it. How does that work?
The data for women and testosterone, there's not a lot of it. And, there is no FDA approved testosterone for women. And we generally just use a tenth of the male dose. I think that for women who otherwise, all of their estrogen effects have been well controlled and they're still having, say, low libido, or they really feel like they can't build muscle mass, energy is low, for the same indications we might give a man testosterone, I think it is worth trying in a woman. In general, though, if her symptoms don't respond after 6 months of being on testosterone, you probably should just take her off because it's probably not really going to do anything.
Okay. And what about other treatments? Like you hear a lot about lasers, sound waves, O shots.
Mhm.
Where are you at on some of those?
Well, laser vaginal treatments for genitourinary syndrome menopause is great. And a lot of women who don't want to deal with vaginal estrogen will do it. But again, that is purely a cash procedure. So, people have to be able to afford that. The O shot, there is, first of all, there is no great science that an actual G spot exists. I mean, my take on that is whether it exists or not, if you feel like that's a great spot for you sexually, go for it. There are people who say the O shot really helped. I think people inject PRP for that. There's also just not great data for PRP in general. But again, if it's not going to hurt you, as long as you're seeing someone who's injecting that, who understands where they're injecting it and they're not doing something crazy to you, listen, it's your money. It's just like someone having a facelift or having, breast implants. If that makes you feel better, go for it. But, you just have to give the disclaimer that, the science is not all there.
What would you like to see that hasn't been developed? Like if you had your dream of some sort of treatment or combination of treatments or something with hormone therapy.
I think the dream is almost there. There is, they do these hormonal pellets, which are not, FDA approved, but the concept, and I'm not sure the pellets, the perfect delivery system, but there is this repository of information where thousands of women submit these questionnaires with their symptoms, and they also have them correlated with their labs. And so it kind of spits out like your dose, which I think that applying AI to hundreds of thousands of women and their lab results and their specific symptoms, I think would be really great. I think that precision medicine is the future of all of it. And I think, especially for hormones, I feel so bad. There are just some women, no matter what you do, you cannot find the right hormones for them. And it fascinates me because you've clearly lived your whole life with estrogen, but yet we still can't find the right estrogen dose for you. So for somebody like that, if you could figure out what the best hormone therapy would be for them, I think that would be ideal. But yeah, I think that applying what we're trying to apply for cancer, every other disease, I think would be great for hormone therapy.
Like data precision medicine and AI
Totally.
combined together.
Totally.
When you mentioned that about women with hormone therapy where you try and try, is there a percentage you could put on that just roughly? I'm curious about that.
It's small. I mean, most women kind of, they're fine, I think, with what is commercially available. But remember, there's only so many doses, right? So like you might have a woman you put a patch on and it's too much. Her boobs are too big or too tender. She's still having, and then you cut it in half and then she's miserable. And you're cutting it in 3/4. It's like it's ridiculous. So those are women who I think are good. And again, this goes back to maybe the science isn't all there. Maybe the FDA doesn't approve it. But I think that there are women who probably do need compounded, like however you want to refer to bioidenticals, because what is commercially available is not as personalizable or titratable, if you will, for some other ones. And if you can find a good compounding pharmacist, they can really help a woman.
So you've mentioned two things in the last few minutes that are incredibly controversial, and you'll see on social media, pellets are the worst, it never go, and compounded hormones are a scam. And so you're a very reputable doctor you went to school for a long time. Can you just give us the straight shot on they're okay? In what circumstances?
Well, okay. So disclaimer, right? Pellets again are not FDA cleared, and so they don't have the same regulation. However, the labs that or the pharmacies that produce these, if you find a pharmacy that has certain licensing, right? Because there are FDA cleared pharmacies. So just because, and keep in mind, we use drugs off label all the time. Okay. And so there are things where, no pun intended, you got to think outside the box. Right. And so, from my perspective, if you would have asked me that question 15 years ago, I would say, absolutely, do not use pellets. They're evil, But after taking care of them for so long and finding that that was the only solution for a lot of women, it's hard to dismiss that. It's also hard to dismiss that you've got tens of thousands of women who now have had pellet therapy. Now, is that the first line treatment for a lot of women? Probably not. I mean, do I try to be what is prescription right off the bat? Yes, but I also have to respect that some women, actually, people in general, can be very suspicious even of the medical field, because back in the day there was a lot of kickbacks, going on, and so people are suspicious. So, I've just learned over time that if the mom says the baby is sick, the baby is sick, right? So you have to listen to the woman. She is intuitive. She knows her body. And two, what we learn in medical school is really not what's necessarily happening in the real world. We don't learn about supplements. We don't learn about alternative medicine. So number one, I think that as long as the woman understands that, these are not FDA approved treatments, but you get it from a reputable pharmacy, I think it is okay to try those. And, technically bioidentical is exactly what we're taking as prescription. They are bioidentical. Right. The only truly natural hormone, and what is interesting is if you are really a animal lover, like Premarin cream, right? Premarin comes from the urine of pregnant mares. So if you want something really natural, you get the urine. So personally, for me, give me the synthetic.
Okay, I just have to pause for 1 second because I have the issue that I discussed earlier. So
Okay.
Okay, so recently I interviewed an OBGYN who said really clearly that when women are having a lot of GSM symptoms, he really likes to look at their gut microbiome. He feels that it's often an issue of blood flow and physical health. How do you feel about that?
Oh, I agree with that. Just like that's the basis of like women using a vibrator on a regular basis.
Okay.
But I don't know what the direct. I do agree. I think your general health for sure, right? It's very interesting. Women who are sexually active on a regular basis, even if they don't take hormones, maintain their function. So back to your use it or lose it statement. But I just think in general, probably having a healthy lifestyle is good for everything. Um, but the microbiome, and I also think the microbiome is very important. How the direct correlation between the gut and the vagina is, I'm not really sure we know about that, but for sure that our vaginal microbiome gets knocked off a lot when we are menopausal if you're not taking vaginal estrogen. So I do agree with the blood flow for sure. The gut microbiome, not sure how much direct effect there is on the vagina, but for sure the vaginal microbiome gets affected by menopause.
Do you think we're going to have research on the vaginal microbiome to the extent that we're seeing now with the gut microbiome?
Oh, it's happening now. It's happening now.
Okay. Because we didn't even know about a vaginal microbiome, what, like 10 years ago or?
Well, we did. We just thought it just was very simple. Lactobacillus, cures all. We didn't really bother to say that, oh, there's actually different types of lactobacillus, and maybe we need a certain pH to promote the growth of lactobacillus. So we understood a very rudimentary microbiome, if you will.
Okay. I hear a lot about we're prone to infection during this time, like bacterial vaginosis. I may have experienced this too. And what's going on there where it's just sort of like this period where it seems like anything you do, you can sort of, when you're younger, it's yeast infections and it feels like at this time it's the BV. What's going on with that?
That's our microbiome getting knocked off. So the lactobacillus should be our predominant bacteria. And again, or whichever strain it should be, Lactobacillus crispata is one of the ones that we think is probably more important. But the bottom line is the lactobacillus, their food, if you will, are the cells that are shed by the vaginal wall. So with menopause, the vaginal wall gets thinner. So literally the lactobacillus are starving and in lower numbers. The lactobacillus make lactic acid, which keeps our vagina acidic, which is what keeps us from getting BV because of the overgrowth of the other organisms.
I have never heard anyone.
Circle of life in your vagina, sister.
So other than hormone therapy, is there something that women can do to sort of help this?
Sure. Boric acid, which is so crazy. It really works. This is what's so interesting. Another thing, like boric acid, if you ate that, you would drop dead. But yeah, we put it in the vagina all the time. But yeah, anything that can acidify the vagina theoretically could help. Boric acid, maybe hyaluronic acid, although it's probably not as acidic as boric acid. But yeah, boric acid is used for decades for women.
And those are supplements, or those are
Use my boric acid over the counter.
the counter, and you put it inside the vagina.
Yes, but you have to be careful because it can be really acidic. So, like women who tend to be really prone to, say, yeast infections, maybe their baseline acidity is not normal. And so, for women, once we kind of get them over the hump, if you will, of like all these repeated infections, like a maintenance of boric acid, they might just use it like once or twice a week.
Okay, this is crazy because when you Google boric acid, they always say don't use it. And I was going to ask you about boric acid. It's one of my questions, but I was going to maybe pretend I hadn't used it or say asking for a friend.
Yeah. Well, we have a friend. We'll call her Anne.
That's really interesting to hear you say that that's a treatment. Yeah, that's like, I mean, it comes up on the top of Google, but when you say, should I use boric acid, it says don't. So I always,
Again, it's probably better that it says that so you can ask somebody, because even though it is available over the counter, I have definitely had women who use it too often and then they get burning because it's too acidic.
okay, good to know. Okay, so you were at the Goop Immersive. I saw that on your social media. Very jealous. Uh, I'm curious because you have products that you sell through Goop, and Goop has been ripped for writing about certain things that are in your area. So one thing that they wrote about years ago, very briefly, they wrote about vaginal steaming, and they mentioned a spa that does a vaginal steaming. And then now anytime I read about Goop, it's like Goop that promotes vaginal steaming. But also there's a huge vaginal steaming movement in the world, and it's been going on for centuries, and there's a documentary coming out about it. So I'm just curious what you think about vaginal steaming. Is this a dangerous practice? Is there any benefit to it at all? Like, where do you sit?
Well, so full disclosure, I've never done vaginal steaming specifically, but I do love the steam room at the gym. So technically, if you've ever done that, you're kind of now, from what I understand, you're just kind of sitting over this thing with steam, right? So that kind of drives me crazy because it's probably not really vaginal steaming. Because if you're doing vaginal steaming, you'd think about putting a steamer inside your vagina, which, yeah, that would probably not feel very good. But you probably should just call it genital or, vulvar steaming or labial steaming. Like it drives me crazy that we say, oh, a vaginal wash. No, a vaginal wash is a douche. You are selling a vulvar wash, which is fine, but let's get the terminology correct because it becomes very confusing. So if someone just wants to do, some hygiene down there, get it like a little steam outside, I think it's perfectly fine. You're not doing it, but that's technically not really vaginal steaming. And again, if you've ever been into a hot steam room at the spa, you have been full body, including vulvar steaming.
Yeah, and people it's funny because people will always say, well, it's very dangerous and you can burn and it's like, well, yeah, people steam their face. You can burn your face too.
Right, of course, yeah.
Right? Like
Yeah, but yeah, again, assuming that I am understanding it correctly, I don't think they're putting actual steam in the vagina, and I definitely would not recommend that.
it's about nomenclature. It's just, if
Totally,
calling it
totally.
what it was. Yeah. Now, jade eggs. Goop did get in trouble because they made some claims about jade eggs, but I'm curious, are jade eggs the devil? Are jade eggs helpful? Are they dangerous?
I don't think, I mean, again, full disclaimer, I don't own jade eggs. I haven't done them, but I just understand they're jade and you put them in your vagina. I mean, people put tampons in your vagina, which is probably like more prone to giving you an infection than a jade egg. I mean, people get toxic shock syndrome from tampons. So I don't really have any strong feelings about jade eggs. I do have a lot of respect for Chinese medicine. I have respect for Ayurvedic medicine. I think anything that's been around for centuries, and back to my comment earlier, when you first start practice, because you're fresh out of training and all you know is Western medicine, and you think that the rest of the world are idiots and that you've got to know hard science. And in reality, a lot of our Western medicine is based on things that have been done for centuries. I have tried my best to help people, couldn't help them, and they found their own, alternative, whether it's Chinese or whatever medicine it is. So you have to, like, you don't know what you don't know. So you have to respect these other things. So listen, if, look at like Korean women, their skin is perfect. Whatever a Korean woman tells me to do, I'm like, I'm in. So, and Chinese medicine I think is really great. So if they tell you put you a jade egg in your vagina, I'm all about, if you want to try something and it's not going to hurt you, try it. Full disclaimer, we don't have science for it, but we don't have a lot of science for like aloe vera, but we know it's really great.
Okay, what are some things we're doing to our vaginas and urinary tracts that drive you crazy that are causing harm? You mentioned douching.
I think one thing that drives me crazy that doctors do is every time a woman has symptoms down there, has to be a UTI. And so we keep giving her antibiotic after antibiotic, even though she's not even getting better. And so then you're really knocking off her microbiome. And now she is having yeast infections and just irritation down there, when all we really need to do is just reassure her and leave her alone and let her own microbiome reset. So I think one thing that drives me crazy is overtreatment.
Okay. Although UTIs are very serious, right? Like you shouldn't.
Of course, if you have a UTI, that is true. But what I'm saying is, like, especially with genitourinary syndrome of menopause, women will have burning all the time, right? It's not burning with urination, but as soon as a woman says burning, oh, it must be UTI, regardless of whether the urine test shows infection or not. And so we keep giving her antibiotics. So no, totally. If you have a legit UTI, that is true. But my thing is, we always just write women off as like only being able to have one thing.
So look a little deeper. And also no, again, you said believe the woman, right? Because often people will think, I don't really feel like I have a UTI. I've had it,
Right.
but he said to take it or she said to take it. So take it. What are some things that we might not have heard about that you see that are more common? I don't know what I'm asking even, but just like uh sexually transmitted diseases we might not have known we had, or I don't know, just things that can happen in the vagina we might not have heard about that we should be aware of.
Well, I think almost every pelvic floor disorder most women haven't heard of, right? Well, most women don't really know that incontinence is common. Most women don't know that they could have a falling bladder. I think that we also give a
Falling
lot of,
bladder. I'm sorry to interrupt. I was going to
it's
ask you
okay.
about falling bladder. I was at a cottage. My friend's mother has a falling bladder, and we were all like, "What? You can get? What is that?" I'm sorry to interrupt. What is a falling bladder?
No, not at all. It's your podcast. So it's much more common if women have a vaginal childbirth, so that the supporting ligaments and muscles that hold up our pelvic organs can get stretched. And it's the equivalent of a hernia. So hernia just means something that is bulging where it's not supposed to be. So if a woman has a falling bladder, her bladder is literally descending into the pelvis, into the vagina. And so she can sometimes feel a bulge.
Okay, and what is the treatment for that?
Well, so here's what I was starting to say was, I think one of the things that also drives me crazy is we give this impression that Kegels cure all. So when women have incontinence or they have a falling bladder and they're doing their Kegels and they're passing out because they're doing so many and they're not getting better, then they blame themselves, didn't do it right, should have done them sooner. When in reality, Kegels really don't typically cure most of these conditions, because especially with if you've never had a vaginal childbirth, you probably just have inherently weak muscles or you're not using them enough. And so Kegels actually will help in that scenario. But if you've had a couple babies and your tissues and muscles are stretched, it's like if you tear the ACL in your knee. You don't do physical therapy, you have to have surgery, unfortunately, if it's bad enough.
Okay. So sometimes you do need to have surgery. Okay. Tell me about your company, Gleason, and natural lubricants and the need for them.
Well, so now that I've been in practice forever, one of the biggest complaints, that I had from women or inquiries like, what's a good lubricant? I'm like, I didn't know. Like, this was like 10, 15 years ago. And I was, young enough that not really worrying about that kind of thing. And then I would always just recommend, the common names that you knew. And then women come back and tell me that they felt like they were more irritated after using them. And then if you look at the ingredients, these are things like we would never use in our cosmetics, right? Which is now why we have that whole push for like clean beauty products and clean everything. So that's how that whole idea came about. That's why there's a water-based one. And then there's also an oil-based one that has CBD, because a lot of women also just have pain. And CBD really has great, anti-inflammatory properties. It also helps with muscle relaxation because some women just get really tense. And the oil just feels really good.
And when you talked about ingredients in the lubricants, it made me think that in the vaginal estrogen, there can be ingredients that are irritating as well. Can there not?
There can. There can. And that's why if there are some women who, if they really, let's say they really need vaginal estrogen, everything irritates them, that's when your compounding pharmacist can be really helpful, because they can compound something in a base that is very hypoallergenic or very mild. And that's why, again, you can't just say, oh, no compounding, no bioidenticals. For some women, that is the only alternative.
Okay. And it was on the tip of my, I can't remember. It's gone. I'm sorry.
Let's see, we were talking about lubricants, clean ingredients.
Ingredients we were talking about.
Shoving chemicals in your vagina.
It's gone. I can't remember.
Putting chemical covered jade eggs in your vagina.
Yeah. No, I guess I might just ask you about what do you see on social media that makes you really happy about this area, and what makes you sort of shudder?
I think what really makes me happy is just all of the conversations going on. I haven't seen so many things that make me shudder, except for what you were telling me earlier, that, people are very negative about, goop or different things. And nobody is perfect in life or social media. So I think that if you're giving the right message 95+% of the time, and you might say something, I'm sure myself included, and maybe a small percent of the time you see something off, I think you got to look at the big picture. So there really hasn't been anything that's made me shudder, except that I agree with you. Like, I don't like when people bash other people or are negative. There's just no reason for that. And I think that women, we need to really uplift ourselves, women empowering women, and have this discussion. Our moms would have never had this discussion. I mean, it's so interesting. I ask a patient like about their family history, oh, my mom died of what? I don't know. We think she had cancer, but we never talked about it. I mean, they didn't even talk about things like that before. I mean, you just didn't. And now, not so much our generation, but for sure the one behind us, they're much more open. It's very different too. Like, I would have never even brought my husband to my GYN appointments. And now these young women are bringing their boyfriends,
Wow.
to their GYN appointments. So it's not just the younger women that are talking, but they're even talking amongst their partners, which is very interesting.
That's lovely. Okay, I thought of the question. It happens, you got to give the brain some time. Do you
Right. Hot flash ink.
okay, yeah. Do you need to take vaginal estrogen? Is it essential to take it and take it for the rest of your life?
If you have, it's like saying, do you have to take hormone therapy? If you're totally fine, you don't have to do anything. And again, that there are women that if you maintain your sexual activity regularly, you will maintain your sexual function. There are many women who don't have any issues, or they're just dealing with mild ones. But if you do have, whether it is recurrent infections, pain with intercourse, and you do benefit from vaginal estrogen, My patients ask the same thing. Do I have to take it forever? I'm like, well, if you figure out how to reverse your menopause, you can stop at that point. But if you have bothersome symptoms and you stop the hormones, whatever you took the hormones for is going to come back.
Okay, that's amazing. Thank you so much. Can you tell us where is the best place to find you and engage with you?
So you can actually, it's Dr. Eilber at downthere.doctors.com is a good place to ask questions. And you can also check out at Down There Doctors on Instagram. We try to post stuff that is useful for women, articles that just come out for women's health. So although pelvic health is our main thing, from what I learned from one of my mentors a long time ago, you can't just treat one part of the body. You have to treat the whole person, which is why I'm also very much diet, lifestyle, systemic hormones, your entire body has to be treated. You can't just treat your pelvic floor and expect to feel good.
Okay, that's great. Thank you so much. This has been
Thank you. Fun.